Okay, hello, I'm Culley Carson. I'm the Rhodes Distinguished Professor of Urology at the University of North Carolina, Chapel Hill, North Carolina, United States of America. I'm here to talk today about prostate cancer and prostate cancer treatment results. We know that prostate cancer has been significantly improved in its outcomes and its diagnosis over the last 10 to 20 years, and indeed the majority of people now survive prostate cancer and prostate cancer treatment. But there are some outcomes of prostate cancer treatment that can cause patients significant morbidity. One of those is erectile dysfunction, the other is incontinence. And in my experience, incontinence is probably the worst of all of the outcomes that can happen after radical prostatectomy or radiation therapy, either one. After radical prostatectomy, some patients, a small number, 3 to 5%, will have stress urinary incontinence. And that may be inconsequential. It may be one pad per day or a little bit of urgency, but it can be so severe that it changes their lives. And indeed, many patients will wear 3 to 4 to 5 pads or even more pads per day to take care of this wide open urinary incontinence. And clearly that changes their entire life and their entire feeling of satisfaction with life. But there are things we can do about that. If patients have mild stress urinary incontinence, we can often treat that with medication or with external collecting devices or pads, and patients are often happy with that. But when it becomes more severe, 1 to 3 pads a day is mild to moderate stress urinary incontinence. More than 3 pads per day is moderate to severe, and more than 5 is clearly severe urinary incontinence. In the mild ones, as I mentioned, medications may help. In the moderate ones, we can usually treat those patients surgically with such things as a sling, which is a device that's placed surgically in about a 45-minute operation. It has no mechanical parts. It takes care of repositioning the bladder so that the incontinence is diminished from 3 or 4 pads a day down to 1 pad or less a day, and patients are generally very happy with that. With more severe urinary incontinence, though, it's more difficult to treat, requires more significant intervention, and we use the gold standard, which is the artificial urinary sphincter. The artificial urinary sphincter has been around since about 1973 and has been re-engineered, changed, improved, and redesigned over those periods of time, and the redesigns continue to this day. But that device, which is very similar to a small blood pressure cuff placed around the urethra and manipulated or managed by the patient with a small pump device that's placed in their scrotum, can change their lives dramatically from 5 pads of incontinence per day down to 1 or fewer pads of incontinence per day. And indeed, the artificial urinary sphincter is very reliable and generally lasts somewhere between 10 to 15 years. And even when it fails, we can replace it. So it's a really great way to improve patients' sense of well-being, their quality of life, and improve their activity level, which goes along with an improved continence. Clearly, any of these procedures are not perfect. The artificial urinary sphincter and the sling can have infections, usually less than 3% of them. They can have mechanical malfunctions, again, a small percentage, but usually can be treated with an additional surgical procedure. So we can help patients. Really, one of the problems that we have is that patients aren't treated early enough. And indeed, there's a study that was recently published that suggested that if patients have significant urinary incontinence 6 months after their radical prostatectomy, they should be offered surgical or other significant options to take care of that urinary incontinence. Waiting 2 years, 3 years, 5 years is not the right thing to do. If they're not having an improvement in their continence and an improvement in their pad usage at 6 months, then intervention is probably going to help them to recover their quality of life and their ability to hold their urine. I can tell you in my own practice that I have patients that are the happiest patients that I have, that I've improved their continence. And I've had patients that I always say are the backpack patients. They come into my office with a backpack full of pads. They have to wear and contain their pads all day long to change them. And after we've treated them, the majority of them are backpack free. So it's a significant improvement in their quality of life.